President-elect Donald Trump selected Robert F. Kennedy Jr. to lead the Department of Health and Human Services. That's the agency responsible for administering millions of Americans' health insurance, medical supplies, approving drugs, regulating food, and responding to infectious disease outbreaks. Today, I spoke with Dr. Paul Offit. He's a pediatrician who specializes in infectious disease, vaccines, immunizations, and virology. Paul Offit is a member of the Food and Drug Administration Vaccines and Related Biologic Products Advisory Committee. What are your thoughts about that appointment and the good and potential bad?
I think it's dispiriting. I mean, when he was on a recent podcast with Lex Friedman, was asked the question, are there any vaccines that are of benefit? He said no. Friedman, surprised by that answer, said, well, how about the polio vaccine? And he said that vaccine killed more people than it saved. Now, this is a man who was born in 1954. He was born before a polio vaccine, a virus that would paralyze 20 to 30,000 people a year, mostly children, that would cause 1,500 children to die every year. I mean, he lived through polio, but nonetheless, that's what he said. He still says vaccines cause autism. And so he's a science denialist. He has these dangerous notions about vaccines that are not only wrong, but disproven. And yet still, he's someone who would be considered for that position. That's the most amazing part to me, that you can essentially declare your own scientific truths. I feel like science is losing its place as a source of truth, that people make up their own truths. And it just worries me.
I worry, and I'm going to ask you, I worry about vaccines because part of the way vaccines, more than just about anything else, work is you have to have buy-in and you have to have what we call herd immunity. You have to have enough people vaccinated so that you suppress the virus or whatever the offending agent you're attacking. If we build questions about it and maybe reduce the number of people vaccinated by 20%, that could affect everything.
First of all, that's already happening. I mean, the CDC put out a report in Morbidity and Mortality Weekly report recently showing that about 3.3% of parents are now choosing a medical or non-medical exemption, a philosophical or religious exemption for their child, which is the highest it's been ever. That there are some jurisdictions where more than 5% of parents are choosing not to vaccinate their children for, using non-medical exemptions. So herd immunity is fading, and you're seeing that. We have a dramatic increase in measles cases over the last year. We've had a 5-fold increase in whooping cough cases from 3,000 cases to 17,000 cases. We've had about 200 deaths from influenza over the past year, which is very high. So you're seeing already the fraying of immunity and what happens with the fraying of immunity. And I feel like when you have somebody like RFK Jr. given sort of a position that has the imprimatur of Secretary of Health and Human Services, all you're doing is further eroding trust, further eroding vaccine rates, and further putting children not unnecessarily in harm's way.
Knowing that this is a potential issue, should there be more education, more use of social media, more ways to reach out? Because there is a lot of disinformation, RFK Jr. aside, there's a lot of disinformation out there. Almost anybody has a voice, and depending on how much money they want to spend or time, can say almost anything.
I think you're right. I think that certainly groups like the National Foundation for Infectious Disease, American Medical Association, American Academy of Pediatrics, et cetera, should all sort of band together and make it a very clear statement that this is a dangerous position. If you're going to have an anti-vaccine activist in an important position, that you're putting children in harm's way. But I think in the end, it's a political solution. I mean, the goal is to have it so that he doesn't have influence. And in order for that to happen, I think he can't have that position. So that's a political decision. So I think you have to find a way to work your way into those members of the House of Representatives and Senate that have influence and have influence, especially among the Republicans. I do think that RFK Jr. Does scare people, including the Republicans. I have to believe they see his statements and many are scared by him. So we'll see what happens, but I think it's a political problem.
Now, one thing he has attacked, which at least on the surface seems reasonable, in fairness to him, is the foods that we're eating, the obesity issue. That seems like he's at least on the right track with that.
All for it. I mean, he talks about Kaylee means and trying to make sure that you exercise and if need be, you diet, and at the very least, you eat the right foods, and so that you can decrease things like obesity and type 2 diabetes and the consequences of those diseases like heart disease or CNS disease. All for it. I mean, I'm young enough or old enough to remember the President's Council on Physical Fitness when I was younger. Great. Let's do that. All for it. But, I think he should stick with things that he's more likely to know, and he doesn't know vaccines.
Do you get it? Do you have access to RFK Jr. to talk to him individually about his concerns?
Actually, I did talk to him about 20 years ago. He called me and asked me questions about thimerosal, this ethyl mercury containing preservative that wasn't in vaccines given to young children. That's not in vaccines given to young children anymore. But and so we had what I thought was a good talk. But he sandbagged me and wrote an article in Rolling Stone called "Deadly Immunity," claiming that the vaccines contain dangerous levels of mercury, which wasn't true. And so that was his sort of launch into the anti-vaccine world. But I don't think he's the kind of person who really is going to listen to data because he hasn't yet. I mean, you look at, for example, the question of whether measles, mumps, rubella vaccine caused autism. I mean, that question was raised in the late 1990s. And you have, 18 studies now done in 7 countries on 3 continents, all showing that you're not at greater risk of getting autism if you got that vaccine or if you didn't. And he still says it. So he's resistant to data. What can you do with someone like that? I'm not a political pundit. I don't know. I'm just trying to sort of stand up for children and children's health as you do. And I do worry that someone like that will only put children in harm's way unnecessarily.
Well, obviously, thank you for all the work you're doing and continue to do. In fact, even today, I know you're running off on your own personal time, doing a lot of different interviews, chatting with people. So I thank you for that, Paul, and I appreciate it.
Thank you, Brian. Take care.